Stroke is a dangerous medical condition, especially for the elderly. Although minor strokes in older adults may seem less severe, if not detected and treated promptly, the consequences can still be very serious. Taking care of the elderly's health, preventing risk factors, and detecting early signs of stroke are crucial in protecting their health and improving their quality of life. Minor stroke in the elderly. Cerebrovascular accident, also known as a stroke, is one of the leading causes of death and disability among the elderly. This condition occurs when a blood vessel in the brain bursts or becomes blocked, leading to a lack of blood supply to the brain, which in turn severely affects the function of the central nervous system. Among the types of stroke, minor strokes are commonly seen in older adults. Although less dangerous than severe strokes, they can still result in irreversible damage if emergency care is not provided in time. Strokes can be classified into two main types: minor strokes and severe strokes. A minor stroke occurs when a rupture or blockage of blood vessels happens near the cerebral cortex, an area with fewer critical functions compared to the deeper parts of the brain. Therefore, the level of danger in minor strokes is usually lower than that of severe strokes, which damage complex and vital brain areas such as the brainstem or centers responsible for essential life functions. Although minor strokes in the elderly are less life-threatening, they can still have serious consequences. Older adults often have underlying health conditions such as high blood pressure, diabetes, dyslipidemia, or cardiovascular problems, all of which are significant risk factors for stroke. Moreover, the aging of blood vessels makes them more prone to rupture or blockage, increasing the likelihood of having a stroke. When experiencing a minor stroke, patients may present symptoms such as mild paralysis of part of the body, slurred speech, or numbness in the limbs. However, these symptoms can be subtle and easily overlooked, leading patients to underestimate the severity of their condition and miss the opportunity for timely medical intervention. Recognizing mild stroke in the elderly. Although a mild stroke does not immediately threaten a person's life, if not recognized and treated promptly, it can progress into a full-blown stroke. Early recognition of mild strokes in older adults is extremely important to help prevent serious complications and protect the patient's health. However, elderly individuals often fail to recognize their condition when experiencing a mild stroke, as the symptoms are usually less pronounced than in younger people. This can lead to late detection and delayed emergency care, making treatment more difficult and increasing the risk of complications. There are several typical symptoms that patients or their family members should watch for, including severe headache. The patient may experience a prolonged and intense headache, accompanied by weakness or partial paralysis, which makes movement difficult. Nausea and vomiting. These are common symptoms when the brain is not receiving enough blood, leading to dizziness and vomiting. Facial drooping and difficulty speaking. An easily recognizable sign is one-sided facial drooping, making it hard for the patient to speak or express themselves clearly. Weakness on one side of the body. The patient may feel weakness on one side of the body, walk unsteadily, and be prone to falling. This is a typical sign of a mild stroke, where limb movement is affected. Irregular breathing. When a brain blood vessel is blocked or ruptured, the patient may breathe rapidly, have shortness of breath, or feel breathless. Reduced vision or memory. A mild stroke can also impair vision or short-term memory, making everyday activities more difficult. If any of these stroke symptoms appear, the patient or their family should take them to the hospital immediately for treatment. While mild strokes in the elderly are less dangerous than major ones, they can quickly escalate into a serious stroke if left untreated, potentially causing severe and irreversible damage. The golden hour for stroke treatment is within the first 3 to 4 hours after the stroke occurs. Early intervention can minimize brain damage and prevent serious complications, such as quadriplegia, loss of communication ability, or even death. Managing mild stroke in the elderly. Stroke is a serious medical condition that can cause long-term consequences, especially for older adults. Although a mild stroke in the elderly may not pose an immediate threat to life, if not managed promptly and properly, it can progress into a severe stroke, leading to irreversible brain damage. Being aware of and implementing appropriate measures to manage a mild stroke quickly and effectively can help protect the health of older individuals. When an elderly person experiences a mild stroke, depending on the extent of brain damage, doctors may recommend suitable treatment options. These treatment methods typically include medication, combined with lifestyle changes, and in some special cases, surgical intervention may be required. Prevention. Preventing mild strokes in the elderly plays a crucial role in reducing the risk of severe strokes and protecting long-term brain health. Here are several key preventive measures. Maintain healthy blood pressure. High blood pressure is one of the leading causes of stroke. Regular monitoring and proper management through medication, diet, and exercise are essential. Control blood sugar and cholesterol levels. Managing diabetes and high cholesterol helps prevent damage to blood vessels and reduces the risk of stroke. Healthy diet. A balanced diet rich in vegetables, fruits, whole grains, and low in salt, sugar, and saturated fats supports cardiovascular health and reduces stroke risk. Regular physical activity, moderate exercise, such as walking or light aerobic activity, helps improve blood circulation and overall health. Avoid smoking and limit alcohol. Smoking and excessive alcohol consumption increase the risk of stroke and other cardiovascular diseases. Routine health checkups, regular medical examinations help detect and manage risk factors early, such as atrial fibrillation, carotid artery disease, or other conditions linked to stroke. Medication adherence. For those already prescribed medications to manage chronic conditions, for example, hypertension, diabetes, taking them as directed is critical.